Um, hello, everyone. Welcome. My name is Dolores Brown. I am the Retirement Benefits Counselor for the American Foreign Service Association. I've been working at AFSA since 2018, which is when I retired from the Foreign Service after about 34 years of a very wonderful experience. My last two posts were DCM in Estonia, and then I was the management counselor in Cairo. I'm very happy to be able to keep my fingers in the pie and help my fellow colleagues as a retirement benefits counselor. We are here today to discuss the Federal Employees Health Benefit Insurance and Benefits open season. We are very lucky to have Paula Jakub with us. She is the Executive Vice President and Chief Executive Officer of the American Foreign Service Protective Association. Sometimes people get AFSPA and AFSA mixed up, perfectly understandable. We are separate organizations, but we certainly coordinate closely, and we're very lucky to have Paula with us. She's a recognized expert on the federal health benefits insurance plan in general, and will dispense a lot of interesting and good advice on how to assess whether you're doing what you need to do with the program. Kyle Logden, her Chief Operating Officer, has gallantly volunteered to take questions. You'll see he has an Ask Me Questions. And he will be able to answer some of them, but he will also keep some for Paula. The presentation will be about 45 minutes long, and we'll have 15 minutes. We may be able to spill over a bit to take care of the questions. Please do remember to make them general. We won't be able to answer very specific questions in this kind of format. So I hope you'll bear with us with that. Before Paula comes on stage, I just wanted to alert you all to a few things that you should know about. This periodical has just come out. It's the annual Annuitant newsletter for Foreign Service. That's all Foreign Service. It has everything you need to know about this year and changes, or how annuitants need to sign up for the healthcare, for instance. They have all the forms in here. AFSA just sent out, or will be about to send out, an AFSA-net on how to access this, but essentially it is on, for those of you who are familiar with RNet, it is on that website. But stay tuned, you will get instructions if you don't know how to access this thing. So that's one thing you need to know about. It has a lot of, if you're thinking of changing your healthcare plans, this is going to have, have all the information about how technically you do that. The other thing that I wanted to show you is that we have, AFSA's giving you a nice little perk. This is an announcement about it. It's a free access to a health plan guide for this open season. That does not sound exciting, but believe me, it is, because this guide is called Checkbook, is the most reliable, most recognized sort of consumer's guide to the FEHB, and it does plan comparisons based on services, based on cost, based on customer satisfaction, broken down by whether you're a family, whether you're single, whether you want temporary continuance of coverage. It really does boil it down, so you don't have to feel as if you have to go through 3 or 4 of those really thick healthcare descriptions. It kind of gives you an overview. You can maybe narrow down what you're most interested in, and then do the more due diligence. So this went out as an AFSA-net, and this went out last week. So if you don't have that, you should get in touch with us, because that will really help you in this search. Also, Paula and Kyle alerted me to the fact that there are AFSPA is hosting various open season events, and there are virtual benefits fairs on long-term care. You can find out about the open season event schedule on AFSPA's, that's AFSPA's, AFSPA.org's website. and you go to events, and they'd have events, it looks like almost every few days, running through open season, which ends on December 14th. So you should be aware of that in case you want more information from AFSPA. Now, the last thing, and this is probably, is that I received this in the mail. It's a survey, and it was about my healthcare plan. And it is from OPM. So you may be receiving a survey from OPM about your satisfaction or your experience with whichever healthcare plan you have. It's important to give your opinion back. So I just ask you, if you have time, please, this is not sent out from your individual healthcare plan. It's sent out from OPM and gives them valuable data on which to assess the various plans. So I've taken up enough time. Thank you for being here. I'll turn it over to Paula.
Thank you very much, Dolores, and good afternoon, everybody. I'm sorry we can't meet in person as we usually do this time of year, but I am very grateful to AFSA for setting this up. Dolores is correct. We are two separate companies, but we have a very close working relationship, and of course, our goal is the best way to help the membership. So with that, I want to talk about the 2021 FEHB open season, what that entails and what that does not entail. I'm trying to move my screen now. Okay, here we go. So the FEHB open season began Monday, November 9th, and runs through December 14th. And this is your opportunity to make any changes that you might want to make to your federal health benefits. Now, part of open season includes the FEHB program. That is your health insurance plan. It includes the federal employees dental and vision insurance program. And it also, for active duty members, includes the FSA Feds program, which is the tax-free reimbursement program. What open season does not include is the FEGLI program, which is the life insurance program, and also the federal long-term care insurance program. But if you want any information on that, I've put those websites up on the screen so you can access that. So let's talk a little bit about COVID. The world changed in a blink of an eye, it seems. COVID became a global concern almost overnight last spring, and it continues to be that. With over 1.2 million deaths worldwide and almost 150,000, if we haven't already hit that, in the US alone. It doesn't seem to be letting up anytime soon. Healthcare utilization has decreased over the last several months. Inpatient confinements decreased, outpatient procedures decreased, and office visits decreased as people were not able to make appointments and physically visit their physicians. Procedures and checkups were delayed, possibly resulting in more chronic or complex conditions in the coming years, which is a concern. What didn't decrease, what actually increased, is mental health visits. And mental wellness continues to take a big hit. Some actually say it's the next pandemic. So what OPM really is looking to the plans to do is bring healthcare closer, bring it to you through things like telehealth and telemedicine, primary care specialists, even behavioral, mental, and emotional health is covered under telehealth. Smart healthcare devices brings healthcare closer to you, and also decision support tools. So you'll see, no matter what plan you have, you will see that these plans are really trying to provide you all of those tools, including those continuing wellness tools that will help you in your health journey. COVID didn't necessarily change the way healthcare is delivered, but it certainly accelerated it. For example, telehealth has been available for many of the plans, particularly for the Foreign Service Benefit Plan, for the last 3 or 4 years. Now it's almost becoming a standard mode of treatment. So it certainly has accelerated. the different types of support and treatments. Why is telehealth so important? Well, telehealth is actually your ability to visit with a provider immediately from your home using your computer or your tablet or your phone any time of the night or day, in your bed, in your living room, in your pajamas, whatever. It's available to members in the United States and also to members overseas, depending on your health plan. So some examples of this care is virtual visits with a primary care physician, maybe following a hospitalization, or to review your labs or imaging. Virtual consultations with a dietitian, especially if you're looking at weight management or something like that. And what is extremely important, especially now, are those counseling sessions to address anxiety or depression or even frustrations that you're feeling because of the situation with COVID. Now, there's another thing called Telemed. What is it and why is it different? Telemed is different because it gives you the ability to visit your own established provider via your tablet or phone through a virtual visit. This can be really useful when you're like for a follow-up visit or to review labs after your physical exam, or even to renew your prescriptions. I mean, how many times have we had to make an appointment to go in and see our physician just to get a refill of our annual prescriptions? So this is really becoming an accepted mode of treatment, and I encourage you to consider it for your next visit. When you talk about connected devices, you're all familiar with Fitbit and Apple Watches that help monitor your steps and your heart rate and even track your weight. And there are emerging options over the last 5 years that includes things like glucose meters, whether it's Bluetooth or cellular capable. There are plans that you can connect your blood pressure monitor so it can help you with that. There's smart scales that support your weight management, and growing new programs to help support with chronic kidney disease, congestive heart failure, and those more serious conditions. Many of these programs actually do include human support where you can actually talk to a nurse or a health coach. So you have a lot of support within the programs for these connected devices. Some examples of these connected devices, this is part of the Livongo program, which many of the plans have partnered with for diabetes and also blood pressure monitoring. They actually send you the equipment, and for diabetes, they send you the test strips as well. Another company out there is called Omada. They're a competitor with Livongo, but many of the plans have partnered with companies like this to provide you with these connected devices. The next thing is decision support tools and programs. And these are extremely important because, you know, if you're like me, rarely does it feel like you have enough time with your provider, especially true in the case of a new diagnosis. What does that diagnosis mean? What are my treatment options? What are the symptoms that I should expect? And when should I call the doctor? Health plans are here to support you. Online tools that will help are available to help provide information that goes way beyond the Google or the WebMD. Your plans have care management programs that are staffed by nurses and other health professionals to answer your questions and to guide you through the maze that may be your new diagnosis. Coaching programs are there to help support your health journey and to help meet your goals. And don't forget about the pharmacy-specific programs to help you understand maybe those new medications and what are the side effects and how to manage them. And when do I call the doctor, or when do I call you back as a pharmacist? So really look at all those types of decision support tools that your plans have out there. And some of these examples include like interactive things. So this is maybe especially important and useful at that second doctor's appointment when you want to learn more about your condition and you want to be a more educated consumer so you can have a better meeting with your physician and you can ask those right questions. So you can read about it in an understandable way and not just that full medicine way. So look at those and see what your plan has to offer to educate you with those interactive tools that you may need to make your appointment a more productive appointment next time. And again, let's not forget pharmacy. Pharmacy is an extremely important and integral part of healthcare delivery. And pharmacy support varies by plans. Many of your plans have benefits that have care management and support, coordinated support between the health plans, care manager, and your pharmacies, whether it is Express Scripts or CVS Health, your prescription benefit managers, pharmacists. Many of them have coordinated support for pain management programs. All of these things that may be very advantageous and helpful to you. Specialty medications continue to be a growing concern because it is a growing part of the pharmacy spend. These are the high cost, very complicated, and oftentimes very confusing prescriptions that you either you have to take at a certain time or with certain things, or it may be infused in your vein, whatever. And your health plans may have specified patient advocates for you and specialized nurses and pharmacists that are trained in that area, that specific condition, to help answer your questions and guide you through and educate you, teach you how to take that medicine, things like that. And when you're going overseas, it always is helpful to know what to expect if you're posted overseas. Planning and coordination is extremely important, especially when it comes to specialty meds. Special packing requirements, depending on what hemisphere you're going to, can be really important as well. So don't forget that your health plan has special support programs specifically for pharmacy. Our focus and OPM's focus is on personal support for you as the patient. Our interventions will offer you the right support programs so that we can take a holistic support approach to you as that individual patient. And OPM is really looking to the plans to provide that and look at you in particular. So let's not let COVID get us off track. Please utilize the options that are available to you where you are, wherever you are. There are programs out there that continue to help you improve those quality measures. If you have diabetes and you need to lower that A1C, or you have high blood pressure and you want to keep that and maintain those right numbers, take advantage of all of the access to care points, whether it be behavioral health or pain management programs or things like that. Most of your health plans have these specific programs available to you. And of course, always take stock of your overall health. Know exactly where you stand. Don't shortchange yourself. Make sure you are still doing that health risk assessment. You can do it by phone. You can do it on the computer to make sure that you understand where your individual challenges lie. Do the biometric screenings. Do something for yourself. You deserve it. So when we are looking into 2021, in addition to all of the neat programs that will help you address your healthcare challenges, make sure you take a couple of minutes, no matter what plan you have, whether you love it, whether you hate it, whatever. Look at the different benefits under the Section 2 in the plans brochure that you can get online. Because there are new benefits, they may be changing a favorite benefit, and this is your opportunity to understand what to expect for 2021. Make sure your physicians are still in the provider network. Could be a big concern. Talk to your physicians about that. Understand any new pre-certification requirements. Back in the day, pre-certification used to mean just for hospital confinement. And man, have we come a long way with that. There are different pre-certification rules for things like high-end radiology, whether it's MRIs or CAT scans or PET scans. There are pre-authorization rules for many prescriptions out there, many different types of medications. You'll need to know that. There are pre-authorizations for other things like ABA, things like bariatric surgeries, things like that. So really look at the pre-certification requirements. And also check out the deductibles and co-insurance and co-pays and see if maybe that has changed, not just with your medical benefits, but also with your pharmacy benefits. We don't want you to be in a gotcha situation in 2021. If you're going overseas, make sure that your plan understands the overseas environment. Regarding payment, what is your plan's allowance for overseas care? Do they base their payment on what the provider bills, or is it based on some overseas fee schedule or some zip code or something like that? How do they handle translations? Will they translate your claims for you? How do they handle the actual physical bill? Do they require that ICD-10 code that is standard here in the US, but not in other countries? And especially with the volatility of what's going on in the world, make sure that you're comfortable with the exchange rates and where your plan is getting them, because this is money out of your pocket. That's the difference. As far as service is concerned, a lot of the plans now will offer a secure internet claim submission so that you can just make a PDF of your claim and ship it off to them to avoid that 2-week mailing time. And many of the plans also offer electronic funds transfer, so you can get your claims reimbursement right into your bank account. And it doesn't matter whether it's stateside or overseas. Their growing number of online customer service tools may be very handy and useful to you now. And if you are overseas, how do you reach your plan? This could be an issue if you need to have a question answered and you actually want to talk to somebody. So these are always the concerns that I talk about when I'm trying to counsel, whether they're with the Foreign Service Benefit Plan or not. These are things that could cost you extra money and extra time. It's not just about the premium. In addition to the premium, there's lots of other things to consider, and you owe it to yourself to sit down and think about the total package. What exactly are you buying? The plans have tons of different wellness programs now. One of them may be very advantageous to you, and it may really pique your interest. Understand the prescription drug benefit, and if there's any changes to that. All important as more and more of us use more and more prescription medications. The mail order drug program is very convenient. If you can use it, I encourage you to look at it. It may save you time and money. Again, look at the difference in the deductibles and copays, that plan allowance and pre-certification. In-network and out-of-network benefits are always very, very important. Does your plan allow you to go out of their network if you want care from a physician or provider that isn't in your network? And if they do, what is the cost difference? Because that could be of concern also. Bottom line is it's really two things. What amount of hassle factor are you willing to put up with? And how do you use healthcare? There are so many plans out there. There's actually 264 different plans for next year. Make sure that your plan will meet your needs. If you go to a chiropractor, make sure your plan covers chiropractic at an adequate level and not just 5, 10, 15 visits. So think about that. There are plans out there that I'm sure will fit your needs. Moving on to the Federal Employees Dental and Vision Insurance Program. As Dolores said, all retirees are eligible to enroll in the Federal Employees Dental and Vision Insurance Program, as long as they are eligible to have the FEHB program. That is what FedVIP says. So this year was a contract year for the FedVIP program. They actually added 2 new dental providers. So now we're up to 7 nationwide providers and 5 regional plans under the FedVIP program. This is still supplemental insurance. And when I say that, I mean that you will have out-of-pocket expense. Do not assume that these dental plans, any dental plan, is as comprehensive as your health plan is, because they're not. While they may pay 100% for your cleaning or whatever, once you get into the areas of even a filling, that percentage is going to go down. Some plans it goes down to 80%. I've seen many of them go down to actually as low as 20%, depending on the service. So really look at what those plans have to offer. Premiums and benefits are going to vary, whether it's stateside or overseas. And just so you know, there is no federal subsidy for this. It's not like your federal health plans that pay around 70 to 75% of your premium. This is all voluntary, and you are responsible for 100% of the premium. Uniformed services retirees are now welcome to enroll in the Federal Employees Dental and Vision Insurance Program. This is not an FEHB benefit. This is a benefit. So you must enroll in it through benefits.com. Now, if you have the dental plan that you love, you don't have to do a thing. It's just like your health plan. It will automatically roll over to 2021. But if you are looking at changing or getting out of the dental plan or going into a dental plan, open season is the time to do it. And you have to do it before December 14th. Same thing with the Federal Employees Vision Program. Again, this was a contract year. We were able to add 1 more plan to the program. So you have 5 vision plans to choose from. Some require only in-net providers only. Some will allow you to go out of network, but of course at a lower reimbursement rate. This is supplemental, so you are going to have out-of-pocket expenses. There are dollar limits for things like exams and frames, contact lenses, and things like that. Again, there's no federal subsidy. You pay 100% of the premium, but these are all extremely good plans. Again, if you like the vision plan you have, you don't have to do a thing. It will automatically roll over to next year. If you are looking at a change or want to get into it or out of it, whatever, this is the time to do it through that benefits website, or you can call the number on the screen as well. But it will not happen through the FEHB program. But let me throw a little monkey wrench in this. While these programs, the plans under the federal program, are extremely good, they are not your only alternative. Whatever health plan you have may have what they call ancillary programs that you can buy. And this is an alternative to the federal programs, whether it be dental and vision, that you can choose from instead of the federal program. Or if you may not want to buy an actual insurance program, many of the sponsors actually offer discount programs. You may have great teeth, you may not want to spend that monthly premium, but it's also to cover you with the what if. Well, what if I need a couple of crowns next year? Do I really want to pay the full monthly premium for the insurance, or would these discount programs help me? You may want to check that out. And many of the plans now sponsor a hearing aid discount program. for US based only. But this is kind of neat because you can actually use this discount program in conjunction with your benefits in your federal health plan. So you could really save a bunch of money. Average savings is about $1,800. And these are all very good hearing aids. So you may want to check that out if you are looking at that, purchasing a hearing aid for next year. So I'm not going to go through this in great detail. This is only for active duty employees. This is the 2021 flexible spending accounts for the federal's active employees. It is the pre-tax reimbursement for the eligible costs that your health plan doesn't pay. Coinsurance, copays, dental, exams, cleanings, things like that. You can put up to $2,750. So far, I haven't heard of any changes for 2021 yet. They usually like to wait until we're completely done with open season and after we've talked to everybody, and then they might make changes. But that was a joke. This year, because of COVID, they actually increased the amount that you can carry over for next year. It is usually $500, but because people aren't able to use their benefits, they increase that to $550 for that you can carry over for 2021, as long as you re-enroll in the flexible spending accounts. But you must do so. I don't know what they're going to do for next year going into 2022, but for right now, it's $550. And of course, there's the dependent care. Now, unlike your health plan and your vision and dental plan, you must take an action here during open season. This is an IRS benefit. It is not a health benefit. So if you have your flexible spending account and you want to have it next year, you must go to fsafeds.com and re-enroll in this. If you do not, you will not have your flexible spending account for 2021. And if you have any rollover money or carryover money, they'll take that too. So don't forget that December 14th deadline. So just briefly, let's talk about AFSPA. I know that many of you, thank you very, very much. And many of you do have the Foreign Service Benefit Plan. Just want to take a couple of minutes to tell you what changes we've made. You know that we are very determined to be partners in your health. We have tons of coaching programs, tons of one-on-one programs. Mental wellness is a specific thing for us for this year and into next year as well. So you do have a lot of programs to choose from, not to mention our robust wellness programs. We've always been determined to meet you where you are. We have a lower deductible for your medical expenses. Our plan allowance overseas has always been what the provider overseas charge since you're in their country. We have direct billing arrangements with many hospitals and providers overseas. We also have those all-important alternative benefits, including chiropractic and massage therapy and acupuncture. And we have a very flexible home delivery drug program overseas as well. So some of the changes that we've had for 2021, there's really not a lot. Our deductible is the same. It hasn't changed for several number of years, actually. It will remain $300 per person, up to $600 for the family, for in-network and overseas. We are adding the Telemed visit in addition to the Teledoc and vHealth benefit we already have. Now, if you remember when COVID hit in the spring, we immediately took out our exclusions and our restrictions on our Teledoc program, which is the telehealth program stateside. We also lifted the exclusions on our telemedicine visits, so you could actually go see your own physician virtually, of course. And in April, we were able to add the vHealth telehealth program for our members overseas. We were able to work with OPM, and they have now become a normal benefit for 2021. We also changed a little bit on how we cover that all-important observation care which is what really gets you if you go into the hospital on an emergency basis, and they may want to do testing, they may hook you up to an IV, may even put you in your own room. You think you're inpatient, you're not, you're outpatient, usually paid under the medical benefit. We changed our benefit so that if you are under observation care for over 24 hours, we start that, then it's paid at the inpatient rate and not the outpatient rate. We are also very happy to announce that we are increasing the chiropractic, acupuncture, and massage therapy benefit from 40 visits a year to 50 visits a year for 2021. And we're very happy to do that. And we did do a little modification of our Living Well Together wellness program to make it simpler and easier and hopefully more understandable for all of our members to earn some rewards for taking care of themselves. For those of you who have our plan, you will be getting your open season packet, and there will be instructions and a whole information on how to reap those benefits for you, up to actually $400 a year. So that hopefully you'll take advantage of that. Now, our biweekly premium, the average for OPM across the board for the FEHB program was about 4.9%. Ours is a little less. These are the bi-weekly information that you have on your screen now. Bi-weekly for self-only, it's $71.75. For the monthly, if you are an annuitant, that's $155.47. I have to put on I have old eyes. For self plus one, it's $178.73 for biweekly. For monthly, that is $387.25. And for the family plan, biweekly is $177.50. And the monthly rate is $384.59. So our premiums have remained stable and competitive. And for those two-party families, you are not required to enroll in two-party. And I encourage you to go ahead and enroll in the family plan. Could save you a few bucks. So in review of your federal employees health benefits open season, this involves the federal employees health benefits program, your health insurance. You've got choice of plans. You've got a lot of flexibility there, and really think about how you use healthcare. If you like your plan, don't have to do a thing about it. It will automatically roll over to 2021. Under the Federal Employees Dental and Vision Insurance Program, it is open to retirees. You again have your choice of plans. This is supplemental coverage, so you will have out-of-pocket expense. And I always encourage my members to do the math. Make sure that you're getting your money's worth out of these programs, or look at the discount programs. For active employees, the FSA Feds is available. It is pre-tax money you can use for your deductibles and stuff. And actually, any eligible medical expense under the IRS code 213D. Don't forget the dependent care flexible spending account. This is the one thing that you will have to take an action on. You must re-enroll in the FSA Feds program in order to continue it into 2021. Open season runs from November 9th to December 14th of this year. So if you want to make a change, now's the time to do it. I put on the screen how you make a change. If you are actively employed, you go through your agency, either their online service, or if they accept a 2809, the paper form. If you are retired foreign service, you go through Charleston. If you are retired civil service, you go through OPM. If you want to make a change for the FEDVIP, for your dental and vision plan, you have to go through benefeds.com. It is self-service system, or you can call the number on the screen. If you are actively employed, then you must go to fsafeds.com and re-enroll in that program if you want it to continue for 2021. I know I've threw a lot of information at you, and I know we're kind of running out of time. This is not the only time that you'll have the opportunity to learn about your open season. There are virtual health fairs that are sponsored by ltcfeds.com, where a lot of the different plans will be participating. And then we are going to have about a dozen different webinars at all times during the day, some even at 5 o'clock in the morning, some at 10 o'clock at night. And this is available to support our overseas members as well. If you're interested in that, please go to afspa.org/events, and you'll learn more about the time and how to look at one of our virtual presentations. Now, real quickly, I want to talk about Medicare and the FEHB primarily, and also the Foreign Service Benefit Plan. If you are overseas, remember, Medicare does not cover you if you receive care outside of the US. Your FEHB plan is primary if you receive any service outside of the 50 United States. You must file with your health plan, even if you have Medicare Part A and B. Go ahead and file those overseas claims directly with your health plan. Under Part A, which is one of the original Medicare programs, this is your hospital coverage. It covers inpatient hospital care, not observation care, hospice care, and some very limited skilled nursing benefits. Under Medicare Part B is the premium is means tested. The Federal Employees Health Benefits Program does not require our retirees to have Medicare Part B. The rules are different for TRICARE folks, but the FEHB program does not require that. The Part B premium is means tested. That means it is based on your income. The higher wage earners must pay a higher Part B premium. What could this mean for you for 2021? It could mean a lot. So the standard premium for Part B is $148.50. If you are in a higher income bracket, as shown on the slide, they will go back to your 2019 tax statement, and they will base your 2021 Part B premium on your modified adjusted gross income line, given those parameters. So you can see where it can be rather pricey if you're in a higher income bracket. Part B services cover the medical coverage, doctor's visit, outpatient hospital, including that observation care, home health services, very limited, durable medical equipment, and things like that. The Part B premium for 2021 is $203. You are also responsible for 20% coinsurance, and you may have extra billing if you go to what they call a non-participating physician, and I'll get into that in a minute. Some plans will cover that non-participating extra charge, some won't. I would recommend that you check with your health plan. For those of you who have Foreign Service Benefit Plan, don't worry, we cover it. Now let's talk about physicians really quickly, because I know that many of you have questions that I want to get to. There are three types of physicians really under the Medicare program. The first type is the provider that accepts Medicare assignment. Now, these providers have agreed to treat you and to be paid by Medicare except what Medicare says is the approved amount. They've also agreed to charge you only the Medicare deductible and that 20% coinsurance. And your FEHB plans will cover that cost sharing cost. So you're golden there. The next type of doctor or provider is what they call non-participating providers, which isn't really true because they do participate in the program. They just don't accept assignment. What that means is they can charge you above the Medicare approved amount, but there's a limit, about 15% actually. The FEHB plans will cover the regular cost sharing, that 20%. You might be responsible for that extra 15%. So check out with your health plan whether you're responsible for it or whether they will cover it, depending on what type of provider you go to. The third type of provider is those private contract opt-out providers. These providers want nothing to do with the Medicare program. They will have you sign an individual written agreement that says you understand it and you know that you are responsible for 100% of their charge. So you can file with your FEHB plan, but because you have Medicare Part B, your FEHB plan will only pay up to what they would have paid if you'd gone to a Medicare provider, about 20%, which means you might be liable for the rest of that. So make sure you understand what type of provider you're going to if you have Medicare Part B especially. Many of the plans, and I wanted to throw this out as well, many of the plans provide what we call Part B incentives. Most of the plans will waive the copays and coinsurance and medical deductibles, which is an incentive for Medicare Part B people. Some of the plans will actually have lower prescription copays for people who have Medicare Part B. And a growing thing now is some of the plans will reimburse the member on a limited basis for a portion of the member's Medicare Part B premium. I've seen it go to $600 a year, some as much as $800 a year. So you may want to check that out as well. Last but not least, what happens if you don't enroll in Medicare Part B? Nothing. It's great to be a Fed. It's great to be a federal retiree. Your health plan will provide you with the excellent benefits that you have been used to all your career. And there is a law, an FEHB law, 890-905, that actually limits your liability. So even if you do not have Medicare Part B, but have the FEHB plan, and you go to a provider who either is a participating or non-participating provider in the Medicare program, that provider can only charge you what they would have charged you had you had Medicare Part B. You're still responsible for your deductibles and coinsurance and copayments that you are now, but it might save you some money because they can only charge you up to that Medicare amount. Now, opt-out providers, though, those private contract providers don't have to follow this law. But just because they don't participate in Medicare doesn't mean they don't participate with your plan's network. So you still may get those discounts that your plan has already negotiated for you. Thrown out a lot of information. There are tons of Medicare resources. I've put them down on the screen. Also on the right-hand side is what we have put out for our members that explains how the Foreign Service Benefit Plan works with Medicare. And you can get that online. But if you have another plan, I'm sure that your plan has something similar that will explain how they work with Medicare. So contact your plan for their Medicare brochure and get some more information about the coverage and how we work together for you. Again, I'm just going to keep this up. This is the additional virtual open season options for you. So you may want to write this down. And with that, I will turn it over to Dolores and see if maybe we might have a few questions.
We do have a few questions, and just very quickly, I'll say to people, AFSA records this. So if you came in late or you have to leave early, or if there's a section that you want to repeat, you can, I'd say in a week or two, you'll be able to go on AFSA.org and see this posted. The second thing I wanted to say is, because these are questions I get all the time, just to repeat, Paula said it, but if you are foreign service and you're changing your health plan, you don't go to OPM, you go to the Human Resource Service Center in Charleston. That's very important. The third thing is, when you see those Medicare B costs according to salary, some of you may have been a bit shocked, but if you're not salary, it's actually income. But if your income goes down later in your life, the Medicare B costs also go down. You have to apply for it, but it does depend on that. And finally, for those of you who did come in late, I can't say that we will get to every question, but if you do wish to ask a question, you can go into the chat function and go to the drop-down menu, and there's a little, little drop-down that says "Ask Me Questions," and you can still go to that right now. And with no further ado, I'll get to the questions. Paula,
Yes.
well, first of all, I forgot to thank you, so thank you very much for being here, and to Kyle and to Richard for organizing this. Where can I find information on plans with coverage outside the US? Is there a way to search for this?
Yes, there is a way to search for it. And what you do, you go to opm.gov/healthcare. And on the left-hand side, it'll say the FEHB. And then it will talk about overseas as well. But it's usually the fee-for-service plans. Foreign Service, Blue Cross Blue Shield, GEHA, things like that. The HMOs, if you have an HMO, that gets tricky because they may provide limited benefits for emergencies only.
Right. Okay. Paula, can you go over the difference between telehealth and telemedicine again? I know the coverage can be different for each.
Sure. So telehealth is a partnership with a company that provides telehealth services where you can just go on and you can get a doctor within 5 minutes, 10 minutes. Should just be waiting for 2 weeks to get in to see your physician. All right. And they have several doctors that you might actually are waiting in the window, if you will, to provide you care. For us, we have a relationship with Teladoc, which in the United States, and we also have a relationship with V-Health for our overseas members. And they have a whole variety of things that you can get. You can go to just a regular generalist, a PCP, a dietitian. Stateside, they have mental health providers, counselors, all kinds of things. So for example, I can tell you, I wanted to go, I had something in my eye, and I wanted them to look at it. So I actually did a telehealth visit with Teladoc, looked in my eye, and it wasn't pink eye or anything. It was just allergies, and they gave me a prescription. It took all of 15 minutes. So that's telehealth. Telemed is actually where you can have a video visit with your established physician. I just had one this week. Many of the physicians now, especially now, are offering video consultations and video visits to their members. And there is an actual CPT code and a modifier that's in insurances, and they will charge the health plan for that visit. It's a real visit. They talk through things, but you have a relationship with your physician already. So it's nice to be able to talk to them and see them on screen. And this is helpful, like I said, just for follow-up visits or for things like prescription refills, things like that. And that is really a growing mode of treatment. And most providers now offer telemed visits because their patients just haven't been able to get to them.
All right. Okay, next question. Is a permanent change of station a QLE, and you get a star if you know what that is, qualifying life event, under the FEHB? About with Fehb?
All right, so under the FEHB, going from a stateside posting to an overseas posting, or going back from an overseas posting to a stateside posting is in fact a qualifying life event. And you can change your health plan. You don't have to, but you can. Well, you have to if you have an HMO and you're going overseas, because an HMO won't work for you overseas. If you're PCSing from an overseas post to an overseas post, or from a stateside post to a stateside post, that is not a QLE. All right. under the Federal Employees Dental and Vision Insurance Program, going from a stateside post to an overseas post, and going from an overseas post to a stateside post is not a QLE. So it is extremely important that you understand what dental and vision benefits you have on the out-of-network level, because when you are overseas, it will be paid at that out-of-network level, and you can't change that until the next open season.
Okay, Paula, you mentioned P like Peter, B like Black, M like Mary, the PBM several times. What is that an abbreviation of?
Okay, PBM, I said the PBM is the Prescription Benefit Manager. This is the companies, like, for example, the Foreign Service Plan has Express Scripts. APWU has Express Scripts as their prescription benefit manager. Other plans like Blue Cross and DHA have CVS Health as their prescription benefit manager. And they hire these to administer their prescription benefits and also negotiate with Big Pharma on getting those discounts and rebates that we enjoy to help keep our premiums lower.
Here's one about Medicare B. How do I avoid being enrolled in Medicare B on my 65th birthday? What if I want to delay enrollment?
So here's the rules with Medicare Part B. Your initial opportunity to enroll, and you have to take an action to enroll, is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Now, for those people who are still actively employed and are having their health plan as an active employee, as an active benefit, then they can delay that decision until they retire. Okay? But if you are retired at age 65, you must make that decision as at age 65. For those people who are still working, you don't have to. You can wait and you will enjoy what they call a special enrollment period, which is the 8-month period following the time you retire or lose your insurance coverage as an active employee benefit. Okay? Now, if you are when you get Social Security, whether it's 66 and a half or 67 or 70, when you decide to take Social Security and you have not enrolled under Medicare Part B, they will automatically try to enroll you in Medicare Part B. And some of you may not want to, so you'll have to contact Medicare and tell them you don't want to. Conversely, if you decide that at age 65, you do not want to enroll in Medicare Part B, and then at age 68, you decide, I want that extra coverage, you can enroll. There's always an annual enrollment period, but you will be faced with the possibility of a late enrollment penalty. And in the terms of Medicare Part B, we're talking they really mean business. For every 12-month period that you did not have Medicare Part B and you could have had Medicare Part B, they will tack on an extra 10% on top of your Medicare Part B premium, and that will last you for the rest of your life until death do you part.
Paula, I actually have a follow-up question on that, because this is really the most fraught question for so many of the people I work with. Do you have any idea what percentage of vets who are eligible for Part B and keep their FEHB plan? What percentage of those people actually end up taking Medicare B?
You know, you would really be surprised that generally most feds will take Medicare Part B, because if they have Medicare Part B and the health plan, they are virtually 100% covered. And they have to weigh the difference between, I have a great health plan with my FEHB plan. Doesn't matter what plan you have, you're lucky to be a Fed and have this excellent insurance. But as you grow older, it's just a fact of life. We use more healthcare, right?
Right.
So while we may only go to the doctor a couple, 3 times a year now, as we age and our healthcare needs increase, every time you walk into a physician's office, it's going to be another coinsurance or copay. So you've got to weigh that against, do I want to spend the money from Medicare Part B now and be fully covered? It's an individual decision. You asked me about the percentage. You know, I give the class at FSI, so I see all of these people and what they do. About 24 to 27% of the retirees do not take Medicare Part B. What does that tell you? That tells you that the majority of them still take Medicare Part B. Now, if, you know, people in foreign service and people who work for State Department are really smart, and they may have that extra income that they would hit that means testing. And that is a, you know, that could be a deal breaker. And again, I can't tell you which way you should go, but there's a lot of different scenarios to go through. Let me throw one more monkey wrench in this, is that every one of your federal health plans has a catastrophic limit, which means that once you reach that limit on what you have paid throughout the year, your health plan will start paying 100%. So that's yet another complication.
Well, that sounds like a good monkey wrench, though.
Yeah, it's a great, again, it's great to be in, right? But yeah, and if anybody wants to talk to me personally about this, I'm happy to answer their individual questions without getting into the weeds now.
That's very kind of you.
Sure.
One thing people need to keep in mind is that if you're going to live abroad, if you're quite sure you're going to live abroad, not in the United States, then Medicare A and B is basically a moot point, correct?
Right, but Medicare A, you might as well take it when you're 65 because it doesn't cost you anything.
Right.
So you might as well take it. And if you're going to live overseas, understand that Medicare decision cannot be delayed.
Right.
There isn't any special caveat for people overseas.
Right.
If you're living overseas and decide to come back to the States and want Medicare Part B, they're going to hit you with that penalty.
Okay. All right. I'm turned to another topic. I don't quite understand, not me, but one of our audience, I don't quite understand the term Medigap. Can you explain this? And
Sure,
now that we've signed up for Medicare, are there any changes we need to make to our federal health plan?
So your Federal Employees Health Benefits Plan acts as your Medigap plan. Okay, the term Medigap came around in the late 70s, early 80s. I'm dating myself. As a supplement to the Medicare program. But you're Fed. You already have it through your federal health plan. So that fills the gaps. Remember when I talked about your health plan will pay for the cost sharing on your deductibles and your coinsurance and things like that. That's what a Medigap policy does for private sector. And as far as your prescription benefits go, your drug charges, you know, Medicare Part D is the Medicare prescription drug benefits, right? You have to pay an extra premium for that, and it's means tested, but you're a Fed. So it doesn't matter what health plan you have with the federal program, whether it's Foreign Service, Blue Cross, GEHA, United Healthcare, it doesn't matter. Your prescription benefits are at least as good, if not better, than the standard prescription drug benefit under Medicare Part D. So if you turn to page 2 on any of your federal health plan brochures, OPM says it outright. You don't have to buy yet another health plan to pay for your prescriptions because it's already covered.
Okay.
It's great to be a Fed.
All right. Here's another. Question from the audience. I'm retired and I have always been the primary for my tandem family. I would like to change over so my FSO spouse will be the primary so we have pre-tax premiums. How do we do this so we maintain continuous coverage under the FEHB?
All right, so if the spouse is still, I assume they're tandem.
Yes.
For assumptions, all right. The spouse is still under age 65 working, they have individual self-only health plans. Okay. During this open season, if they want to, the spouse would go to self and family or self plus one, depending on the health plan they have. The retired person would drop the coverage, okay, and they could pick it up back in their own right because they will have been covered under the federal health plan. Okay, what that does is that puts him or her into the active employee federal health plan bracket, which means that they do not have to take Medicare Part B because they are covered under a health plan that is a benefit of an active employment. Now, once that spouse retires, then they're both going to have to make that Medicare decision.
Right. Okay.
And if whoever had that question wants to write me, I'll be happy to send them the actual material.
Okay, thank you.
Sure.
Okay, my doctor prescribed one drug, but I received another without any notice. Why would this be the case? Can you explain generally how step therapy and formulary rules might cause this change?
Sure. Depending on what plan they have, we all have different step therapies and interchangeable rules. Now, many state laws require that we send a generic. All right, unless it's written as dispensed as written DAW. Okay. Most of the time, the plan will send a preferred drug if they can, because it saves the plan money and it saves the member money. There are always appeal rights. So if the member, it doesn't matter what plan you have, if the member wants to appeal that, the doctor certainly can, and there are instructions. All they have to do is contact their health plan, and they can formally appeal that. But this is part of the standard process now, and it's not just the FEHB, it's throughout the entire country. Doesn't matter whether it's a federal plan, state plan, private sector plan. It's administered by these prescription benefit managers, and the goal is to get the right drug, the best drug, in the hands of the patient at the least possible cost.
Now, this is about FSA.
Mm-hmm.
Can I have FSA for the year in which I retire? And that's the federal flexible spending account. Is that you?
Yeah, you can have the FSA in the year that you're retired, but there are very strict laws about when you have to use that FSA money. So I would recommend that you go to the FSAfeds.com website and read those Q&As. Those frequently asked question, and there is a section on that about retiring, because and these are IRS laws as to when you must use that money.
Okay.
It doesn't work like an HSA.
Right, and that is the flexible spending account.
Yes, that's
right.
The pre-tax reimbursement.
Okay, here's another one on our favorite subject, Part B. How does Medicare Part B work if you have a spouse who is not yet 65 or significantly younger? Does the means testing look at the couple's joint income if filing jointly? I'm thinking of a case where the FS employee is retired and not working, but the younger spouse is still working and still has a higher income.
All right, so they don't care whether you're working or not. What they care about is what's shown on your 1040. So if you are married and file jointly, That is what they're going to look at. They are going to look at the tax return. And they're going to look at the modified adjusted gross income line. That's how that works.
Okay, I think this is going to have to be our last question.
Okay.
Will my adult children automatically be dropped from my insurance when they turn 26, or do I need to do it in open season? Also, can my children get their own insurance a month before their 26th birthdays, or do they need to do it in open season? And this may also be an opportunity to talk about TCC for those people who don't know about it.
So your child will come off of your health plan at age 26. And they do have the opportunity to enroll in TCC, and they can choose any plan for which you yourself are eligible. They do not have to have your plan. And that will last, and that goes through the National Finance Center. Okay, and if you want more information about that, go on the OPM website or go to your plans brochure in the back, and they will have information on TCC. There are also other options out there as far as in addition to the Federal Employees Health Benefits Program. Now, there's no requirement, and many of the plans do not advise you that your child will drop off. It's just automatic. But if you have a family plan or a self+1 plan, and your child drops off, then you should contact HR, because that would be a qualifying life event. You would have to move to either self-only or self+1.
Yeah, and actually I went through that myself. And if you're self and family, if one of your children automatically goes off, the HR service center isn't going to know whether you have other dependents. They're not going to adjust your payments. So you do have to go to them, or else you're going to continue to pay for self and family. And just to say, the TCC does cost you have to pay for it. Your child at 26, once they sign on to it, they do have to pay for it.
The TCC though also is very expensive, because unlike the employee who gets the government pays 70 to 75%. If your child goes on to TCC, the child is responsible for 100% of the premium plus a 2% administrative fee. That's right. Which is why we like to point out all the options for our members whose children are turning age 26.
Right, exactly. Well, first of all, thank Paula Jakub for being with us and sharing her expertise. Thank you, Paula.
You're very welcome.
And to Kyle for fielding all of the questions and for being here to support. That's great. Richard Bruner, who is our AFSA president's executive assistant, who set up all the support. I thank him. And also I thank all of you AFSA members out there for sticking with us and we really appreciate your support. So I hope this was useful, and certainly if there's any other questions that you might have, Paula has volunteered to field them, but if there's anything for me, and actually I'm the retirement benefits counselor. I do more than health insurance. I try to get people in the right place for, to refer them for any questions they have about retirement benefits. And you can find me at Brown, that's pretty easy, brown@afsa.org. So with no further ado, have a good day. Thank you for joining us.
Thank you very much.
Bye, everybody.
Bye-bye.